you suffer with heartburn or acid reflux? Do you take the purple pill, also known as omeprazole or Prilosec, or other proton pump inhibitor or PPI drugs? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Up to 25% of the population suffers from heartburn at least once a month. Other symptoms or conditions such as gastritis and IBS or irritable bowel syndrome also receive proton pump inhibitor prescriptions. These drugs are meant to be used for a short period, maybe 2 weeks at a time. They were considered initially to have low side effect profiles, but research has shown that the longer you take them, the higher the risk of things such as dementia or kidney disease or other issues such as malabsorption of vitamins and minerals and gut dysbiosis or SIBO, or rebound stomach acid hypersecretion and increased reflux. So the symptom that it was originally prescribed for, acid reflux, can actually get worse by taking the drugs. So we need to ask the question, well, what's really going on and what is being missed? And so when we're talking about acid reflux or heartburn, what we need to realize is that conventional medicine looks at it as too much acid, and that's why they prescribe the proton pump inhibitors or the stomach acid production inhibiting drugs. When in actuality, oftentimes it's actually a case of too little acid. So think about it this way. If you're having acid reflux or heartburn because of too little acid, and you prescribe a proton pump inhibitor, which further decreases your acid production, then what's that going to lead to? Bigger issues. Stomach acid is the first step in protein digestion. If we knock down stomach acid production, we're not going to digest our protein well, because the majority of protein digestion should occur in the stomach, and then it moves into the small intestine and it's finished by proteases and brush border enzymes. But if we don't do that majority of digestion in the stomach, that lump of protein can move into the small intestine and feel like a rock in there. And then it can be fermented by bacteria, which produce gas, and it can lead to gas and bloating and maybe constipation and further inflammation, which can drive further heartburn symptoms and even SIBO or small intestinal bacterial overgrowth. So taking a proton pump inhibitor, if you're having low stomach acid already, can drive all kinds of bad things downstream. What needs to happen is a true and thorough assessment of the individual to determine what is the cause of the low stomach acid. It could be autoimmunity against the parietal cells of the stomach. It could be a Helicobacter pylori infection in the stomach. It could be an ulcer. It could be multiple things. So instead of just covering up the symptoms with a drug, which can exacerbate the symptoms, we need to ask, what is the cause, address that cause, which will result in removal of the symptoms and a better quality of life. And so always think, hey, if I'm having heartburn or reflux or irritable bowel syndrome or ulcers, am I really having too much acid or is it too little? And if so, what's the cause? And address the cause.